Hi, welcome to Dr. Medics. Patella. Patella is the largest sesamoid bone situated in front of the lower end of the femur, about 1 centimeter above the knee joint. Patella developed in the tendon of quadriceps femoris. Side determination of the patella. Triangular in shape with its apex directed downwards and which is non-articular. Anterior surface is rough and non-articular. The upper three-fourths of the posterior surface are smooth and articular. Posterior articular surface is divided by vertical ridge into large lateral and a smaller medial areas. Bone laid on the table rests on the broad lateral articular area and it determines the side of the bone. Anatomical position and features. Anterior rough surface is put anteriorly with its apex pointing downwards. Posterior articular areas is put posteriorly. Features. Patella has apex, 3 borders, 2 surfaces. 3 borders consist of superior, lateral, medial. 2 surfaces consist of anterior and posterior. Features of the patella. Apex directed downwards, rough and vertical rigid. It is covered by an expansion from the tendon of the rectus femoris and is separated from the skin by prepatellar bursa. Posterior surface articulates in its upper three-fourths, non-articular in lower one-fourth. Articular area divided by a vertical ridge into a large lateral and smaller medial portion. Another vertical ridge separates a medial strip from medial portion. The strip articulates with a reciprocal strip on the medial side of the intercondylar notch of femur during the full flexion. Medial and lateral portion of articular surface divided by 2 transverse lines, which divided into 3 pairs of facets. During various phases of movements of the knee, different portions of the patella articulate with the femur. The lower pair of articular facets articulates during extension, middle pair during beginning of the flexion, upper pair during mid-flexion, and the medial strip during full flexion of the knee. Attachments. The superior border or base provides insertion to the rectus femoris muscle in front and vastus intermedius muscle in behind. The lateral border provides insertion to the muscle vastus lateralis in its upper one-third or half. The medial border provides insertion to the vastus medialis muscle in its upper two-third. The non-articular area of the posterior surface provides the attachment to the ligamentum patellae below and is related to infrapatellar pad of fat above. Thus, quadriceps femoris muscle is inserted into the patella, from where ligamentum patellae arises, which ends into the tibial tuberosity. Ossification. The patella ossifies from several centers, which appears during 3 to 6 years of age. Fusion is complete at puberty. 1 or 2 centers at the superolateral angle of the patella may form separate pieces of bone. Such a patella is known as bipatel or tripatel patella. The condition is bilateral and symmetrical.